Have you ever wondered how doctors can predict the risk of genetic conditions in an unborn baby without doing any invasive procedures? Imagine knowing important details about your baby's health as early as the second trimester, all through a simple blood test. That's exactly what the triple marker test does. In this video, we're going to break down what the triple marker test is, why it's done, when it's recommended, how to prepare, what the results mean, and the questions you should ask your doctor if you're considering it. By the end, you'll have a clear understanding of whether this test might be relevant for you or someone you care about. Stay tuned because this could be one of the most important decisions in a pregnancy journey. What is the triple marker test? The triple marker test, also known as the triple screening test, is a type of prenatal screening. It's called triple because it measures 3 specific substances in a pregnant woman's blood: alpha-fetoprotein, or AFP, which is a protein produced by the baby's liver; human chorionic gonadotropin, also known as HCG, which is a hormone produced by the placenta; and estriol, which is a form of estrogen made by both the placenta and the baby. The levels of these 3 markers can provide doctors with clues about the likelihood of certain conditions in the baby.
Why is the test done? The triple marker test is primarily used to estimate the risk of Down syndrome, a genetic condition caused by an extra chromosome; Trisomy 18, another chromosomal abnormality that can affect growth and development; and neural tube defects, such as spina bifida, where the spine or brain doesn't develop properly. It's important to note that this is a screening test, not a diagnostic test. That means it does not give a definite yes or no answer. Instead, it tells you whether the risk is higher or lower so that you and your doctor can decide if further testing is needed.
When is the test recommended? Doctors usually recommend the triple marker test between 15 and 20 weeks of pregnancy, with 16 to 18 weeks being the ideal window. It may be especially recommended if the mother is over the age of 35, since the risk of chromosomal abnormalities increases with age. There's a family history of genetic conditions. Previous pregnancies had complications related to chromosomal or neural tube defects. The parents want additional reassurance about the baby's health. How is the test done? The process is simple and non-invasive. A small blood sample is drawn from the mother's arm. That's it. There's no risk to the baby, and the discomfort is minimal, just like a routine blood test. The sample is then sent to a lab, where the levels of AFP, HCG, and estriol are measured and compared against expected values for the specific week of pregnancy. How to prepare for the test? Unlike some blood tests, you don't usually need to fast for the triple marker test. However, doctors will need accurate information about your pregnancy, such as the exact number of weeks, your weight, age, and medical history. This is because the interpretation of the results depends heavily on these details. So, one of the best ways to prepare is simply to make sure your doctor has the most accurate information possible. This is where many parents get confused, so let's make it simple. The test results come back as either normal or abnormal. But remember, this doesn't mean your baby definitely has a condition. High AFP levels may suggest neural tube defects like spina bifida. Low AFP combined with high HCG and low estriol may indicate a higher risk of Down syndrome. Low levels of all 3 markers may point toward trisomy 18. If the test shows a higher risk, your doctor may recommend additional tests like an amniocentesis or an ultrasound to confirm the diagnosis. It's also important to understand the limitations. The triple marker test is not 100% accurate. There can be false positives, meaning the test shows a higher risk when the baby is actually healthy. There can also be false negatives, where the test doesn't pick up a condition. That's why it's considered a screening tool, not a final answer. It helps identify pregnancies that may need closer monitoring or further testing. Despite its limitations, the triple marker test has clear benefits. It's safe and non-invasive. It provides early insights into potential conditions. It can help families prepare emotionally, medically, and financially if a condition is suspected. It allows doctors to plan for closer monitoring of the pregnancy if needed. Should you take the test? Ultimately, the decision depends on your personal circumstances, medical history, and preferences. Some parents want as much information as possible, while others may choose not to do screening because it can create anxiety. It's a very personal decision, and the best step is to discuss it openly with your healthcare provider who knows your medical background and can guide you on whether the triple marker test is suitable for you. So, to recap, the triple marker test is a safe, non-invasive screening test done between 15 and 20 weeks of pregnancy to assess the risk of conditions like Down syndrome, Trisomy 18, and neural tube defects. It doesn't give a definite answer, but helps guide further testing and decisions. Now, I'd love to hear from you. Do you have questions about the triple marker test? Or would you like me to explain other prenatal screening options like the quadruple marker test or non-invasive prenatal testing? Let me know in the comments below, and we'll be here to help guide you through. If you found this video helpful, don't forget to like, share, and subscribe for more health and pregnancy-related content. And remember, your healthcare provider is your best source of personalized advice. Thank you for watching, and I'll see you in the next video.